Hey, Keith. It's John here. You asked for stories about people's healthcare crises, about real people who've had problems with the healthcare industry, so I thought I'd share mine. Um, I was a entrepreneur, go-getter America. I went out and started my own company and was doing computer consulting and repair and website design. Things were going pretty good for me. My wife worked at Verizon, and we had our first baby. Very, very happy. And my wife decided right after having the baby that she would stay home. So we lost her insurance and I purchased my own policy for my family. It was pretty crappy insurance, to be fair. We had to pay a lot and there was a really high deductible and it didn't cover that much, but if we hit that sweet spot where something bad happened but not too bad, we would be covered. So I guess it was better than nothing. But about 6 or 7 months after the baby was born, they had discovered not too long after she was born that she had small holes in her heart between two chambers of her heart, and it was causing a murmur. So they started monitoring that, and we had a bunch of cardiology visits leading up to it. It was all covered. And then 6 months later, the insurance company decided that it was a pre-existing condition, because we still had my wife's Verizon plan when the baby was born. And so the baby was born with the holes in her heart. So even though they kind of knew about them, they said they were going to go away. Since they didn't go away, it was considered a pre-existing condition. And not only were they refusing to cover my baby's cardiology treatments from that point forward, we owed them 6 months worth of payments for all the cardiology for all the cardiology treatment we had up until then. It pretty much bankrupted us. So what did that mean? Well, I was forced to stop being an entrepreneur. I had to stop running my own business. I couldn't get insurance anymore. They wouldn't cover my daughter, and nobody would pick us up, once they stopped covering her. So I was forced to go work for the state. So the only alternative I had to the private healthcare system, the only alternative it gave me, was to go work for the government. I mean, you want to talk about big government intrusion. The private system made me work for the government. I forget government-run healthcare. I had to go work for them in order to get healthcare for my daughter. So that's my nightmare scenario, and I just thought I'd share it with you because this is an issue that really, really means a lot to me. All right, take care, and try not to burn in hell or anything, you atheist. Bye.